Hi everybody, thanks for coming in today. My name's Lynette Hill. I'm a qualified registered naturopath. I'm an advocate of natural medicine and natural health, and I'm a co-host of a Health Bites TV web program that we run once a month on a Monday night. So come along and talk to me later and I'll tell you all the things I'm involved with, and then we can point you in the right direction. So today I'm just here to talk to you about natural medicine and to try and demystify what that actually is. So to start with, I'd love a show of hands of anybody who knows what a naturopath is. Oh, hooray, this is good. Has anyone seen a naturopath? Excellent. And is anyone a naturopath? Oh, me, yes. So welcome. I'm a registered naturopath, and that means I have a degree in natural medicine, and I'm also part of the registration for naturopaths in New Zealand. And that's a really important thing that you need to be asking when you're going to a naturopath, is are they actually qualified to give you the information that they are. So I'm just going to talk to you a little bit about natural medicine and health. So what is health? This is often our first introduction to health, is through the medical system. And thank goodness we have such a good free medical system in New Zealand, because I've used it very, very often. But it's not always a happy place to be in this health system of ours. So today I want to talk to you about my idea of good health, and that's being vibrant and happy, in good relationships, your body working as well as it possibly can, or better than it was yesterday if possible. We want to see less of this polypharmacy. Medicine's great when we need it, but we're seeing people on more and more medications, and those medications are often leading on to other symptoms that are taking us away from the original reason that we need medicine. So we want to have a whole lot less of that in our diet and a whole lot more of this. And this is the stuff that you do every day, the food that you put in your mouth every single day, the water that you drink. You know, we can make such a change to our health just by getting the basics right and starting in our own pantries. And this is such a great show, isn't it? It's just got so many different opportunities for us to try these beautiful, healthy things. I'd like to talk to you about Dr. Google. Has anybody here been to Dr. Google? I know I have on a few occasions. Yeah, and he's really good, isn't he? Like, he can teach us lots of things. I've learned a lot of, what's new and what's different, and what on earth are my people talking about that they tell me they're taking when they come in to see me in clinic. And Google's great, but I've just got a couple of little suggestions about Dr. Google. He doesn't have rooms, so he doesn't get to meet you. He doesn't know really who you are, and that you might, what you're eating, what other medication you're on. He can't take your blood pressure, he can't look you in the eye, and he certainly can't create a personalised plan for you. So whilst I love to see people researching and finding out a little bit for themselves, if you're trying to deal with a serious or a chronic health issue, please maybe give Dr. Google the slip and go and see a qualified naturopath instead. We're talking about trying something new. That is very light. So what do you think when you hear the words naturopath, homeopath, medicinal herbalist, clinical hypnotherapist? This is kind of the misconception that we're dealing with. So that's okay on the weekend as well. So basically, this is what we're trying to demystify, is that we're all just, saying nice things and putting little spells on you. We actually do the Bachelor of Natural Medicine as a full-time 3-year degree at South Pacific College of Medicine in Auckland, and there's also Wellpark College in Auckland as well. And these are really well-run, highly qualified degrees. So we're trained to make personalised medications for you. So they could be homeopathic or herbal, or we can use practitioner quality supplementation, but only if you actually need it. We love hands therapy, so reflexology, lymphatic drainage, massage, these are all really important parts of our toolkit. We do a lot of research, and we also use a little bit of Dr. Google from time to time. We are very, very evidence-based and science-based. Our clinic, there's a little picture on the slide there of HemaView. We also do Hemaview, which I'll talk to you a little bit about. And we are very, very professional. So gone are the days of hippies handing out tinctures. We are to be taken seriously these days. I do encourage you to always ask your therapist, what qualifies them to say this to you, to ask you to make these changes. So do look for qualification and do look for registration. And that you can do on Google. See, Google's great. The kind of study that we do for natural medicine, I'm going to read it out so I don't get it wrong. You will have a BNAT Med that you're looking for, a Bachelor of Science in Complementary Medicine, Human Nutrition, Sports Science, Homeopathy, and Diplomas in Nutrition. These are all minimums that you want to be seeing on someone's business card. We're trained in the sciences and biochemistry, anatomy, physiology, pathophysiology, immunology, psychology, nutrition, herbal medicine, homeopathic medicine, clinical practice, so that's hands-on. So you can see that we really do know what we're talking about when we have a chat with you. And this is very important to me. With natural medicine, I don't want it to be, well, if you see a naturopath, you can't see a doctor. If you see a doctor, you can't see a naturopath. My attitude is that we need all of everything, but only what we actually need. So if someone comes to us and they're on blood pressure medication, we won't be telling you to get off that, but we'll be looking at, are there any things that are happening in your lifestyle that are making that condition worse? Is there anything we can do to improve it? And we can look after your liver and your kidneys while you're taking that medication. So that combination of medication is often just what people need. And of course, if we can get you better without medication, then that's our aim. That's always what we'd rather do. We often get asked, well, I eat salad and I drink water, so why would I need a supplement? Our lives are really, really busy, and sometimes there's more in our life than our body can cope with, and sometimes our diet's not all that, and sometimes our gut's not as good as it can be. So we'll just have a wee look at a typical day. So we get up and we hit the snooze button and 2 or 3 times, and inevitably we realise we actually have to get up. We have a nice relaxed breakfast, maybe, with our family, fit in a little bit of housework before we go to work, hit the traffic, that's always fun, and then we deal with our lovely work colleagues all day. In my case, my work colleagues are actually really cool. Fitting in some food in the car, maybe, doing some exercise to make us feel better, and that's generally how most people are looking at about 5 o'clock before they go home to their happy, quiet, calm family, and then they go to bed, don't sleep, and do it all again tomorrow. So sometimes we need a little bit of help. It's not a wonder we're seeing so much chronic fatigue, so much anxiety and depression, and people that really, sit down to have a cup of tea and fall asleep. We can help with that. In essence, through natural medicine, it is actually about getting the basics right. So, getting out in the sun and the fresh air, that's really important. Drinking water. No sense giving you a pill for dehydration. If you're dehydrated, we'll get you drinking water. Water's a really big thing. Rest, fresh air, exercise, and that has to be personalised to you. You're not going to get energy if you're exhausted by doing more exercise. So you need to get some good advice on that one. Diet is important. And for me, I would add into this list good relationships. If your day is caused by stress from friends who stress you, have a friendectomy and move on. Get rid of that stress from your life. Have you noticed with natural medicine that there's lots of trees represented, and the tree of life is a really big thing? Well, this is the tree from My Remedy. It's our logo, and I'll explain how I made it so that you understand how I tick. At the top are the dots, the little red circles. They're there to represent the symptoms of health, and those symptoms could be good or bad. So they might be good health symptoms or not so good health symptoms. If we simply trim those off all the time, or we'll get rid of that, we'll put a plaster on that symptom's going to keep occurring over and over again. So as a naturopath, we come down the branches and into the trunk, and we look at, why are those symptoms there? Is it what we're eating or not eating? Is it something we're doing? Is it something we're exposed to? What else is going on? So a naturopath works not at what you've got, but why is it there and what are we going to do about it? And at the base of our tree are the roots. I'll talk to you in a little moment about homeopathy and hypnotherapy. But what we are actually embedded in has a huge impact on our health, so our thoughts and our conditioning and our behaviours and the genetics that we bring through from our family. Some of us aren't all that blessed with our genetics. So what our health is grounded in is very, very important. So we're looking at the symptoms, the whole picture, and the mind and the thoughts as well. And in the middle of our tree, and this is the most important thing, some people don't notice it, most people do, there's a great big heart. And that's in the middle of there because that's all about love, commitment, and passion. And I'm totally committed to myself as a human being. I have been down the road of cancer, and I've worked very, very hard to get through that and to be here and to be healthy right now. So I have a huge passion for getting people well. It's a passion for our profession. It's a passion for every patient that comes in here. So it's really big in my remedy, and I would imagine with most naturopaths out there also. So that's our tree. Oh, I had dots. And I just put this slide in because a lot of people go, oh, it's all that new age stuff. It's not new. Herbs have been around forever. They were our medicine. They're the original medicine. And a lot of Western medicine is based on what they've learned from our herbs. And I don't think we need to forget what's in the past. I think we need to remember it and keep it and go on with that. It's a very safe way of working. So what can a naturopath help you with? Anything, pretty much. Acute conditions, snots and grots, poos and spews, not feeling very well, go and see a naturopath. They hopefully will have an acute condition, give you maybe a homeopathic remedy or some herbs to really stimulate the immune system, give you a good quality dose of vitamin C, and make sure it's okay with the medication that you're on. So that's a great place to start. And I used to have a wee giggle to myself when someone would ring up to cancel an appointment because they were sick. And I wonder what they think I actually do. Chronic conditions. These are things that have stuck around for a long time. They may be genetic, they may be created, they may be due to a medication that you're on, or that you've had a chronically unwell gut for a very long time. And this is where we love to work. So we work in consultation to find out as much as we can about you. What's working, what's not working, you know, do you have bloating, do you have headaches, what's going on? And we work to find out, you know, when did those changes start happening? And we try and turn your health clock back to a point where you're really healthy again. We can't fix everything, but we can certainly improve the situation for you. And even with the best diet and the best intentions, we have people coming on saying, I eat well, why don't I feel well? Well, that's what we're there to discover. It may simply be that your gut's not working all that well and it needs some really specific changes made, and we'll get you back on your feet again. So when things go wrong, if you have a headache or you have bloating or you have pain, it's not to be ignored. That's your body's way of saying, you know, help, something's wrong. If you're going and you're getting blood tests done or seeing your doctor, that is fantastic because we want to rule out disease. But if you've still got those same symptoms when you leave and you've got a label but no help, then that's the time to come and see someone like a naturopath who can find out, well, you know, we can do something about that gut or that liver or those headaches. There's always something that can happen. And a lot of people just think, well, it's probably something I'm eating or something I'm doing. And they start cutting out foods. Who's done that? I've done that. Yeah, guilty as charged. What we're finding now is people are just chopping out whole food groups and they're missing out on nutrients that they would be getting from that food group. If your gut's not healthy, you're going to react to everything. It's like, oh, well, I mean, bread is the big one. We all have heard about gluten. It's probably the most irritating thing to an unhealthy gut. To a healthy gut, no problem. But if we start cutting out bread and the body goes, oh, I felt a bit better, but now, no, I'm still not well, so now I'm going to react to dairy. No, still not well. Oh, well, I'll react to bananas next. And we get people coming in who eat 6 or 7 things in their diet. And that's really frightening. So we work with those people to get their gut working so that they can eat more food. I love food. So yeah, get some advice before you start self-diagnosing, please. And small changes in your nutrition can make the hugest difference to your life. Hugest difference. Even water. Who here has heard me lecturing them about water? I know there's someone. She's looking very guilty on the front. So making these small changes can reduce that need for polypharmacy, and that's really ideal. This is Hemaview. It's what's on the inside that counts. And we're demonstrating this out at the My Remedy stand just next door at the moment. We're looking at your red blood cells to see for signs of toxicity. We're looking if there's fibrin in your blood. We're looking at nutritional deficiencies, how well your cells are surviving for an indication of oxidative stress. We're looking at platelets for examples of inflammation. It is not a diagnostic tool. We don't look at it and go, you've got this disease or that disease. It's merely a snapshot of what's going on right now in your blood. And these are the sorts of things that we're checking for. We do that as a part of a consultation usually. At the show, we're just showing people what it's about. But what Hemaview allows us to do is understand our symptoms. You know, what's going on with my gut? We can see some indications in there that we know what we're going to do about it. Really narrows our choices down and makes it very easy to work on. We're looking at the immune system. Someone who's always sick or never quite well, Hemaview gives us some really good information about that. And people who are always tired, if the cells are collapsing, you've got no oxygen. So we'll be looking at that. If the blood's looking perfect, we're going to be thinking really hard about adrenal fatigue. So it gives us many, many choices. Homeopathy took me 4 years to study it, and I still can't find the way to describe it, but it is a powerful medicine, and it's based on following a symptom and matching a symptom with a similar medication. So if anyone here has used arnica, a little bit, if you have a bit of a bruise, arnica helps your body to heal fairly rapidly from that injury. And we use homeopathy in our clinic a lot with children. So when a child comes in and they're screaming with teething, we'll whip out and get them some kelp foss or something for their pain, and they'll settle down and we can actually chat to their mum about what's going on in that child's life. It's really good for, you know, your acutes. We also use it for that deeper stuff, those roots of our tree. You know, where are you stuck? Things like self-belief. No amount of vitamin C is going to heal self-belief. So we use homeopathy to get into those deeper emotional hurts that some people experience. And those are things that can keep us in sickness and keep us in stress. We also really love clinical hypnotherapy. We really love this, especially for the blokes, because they don't want to talk about their feelings, but they just want to change their minds. So it's really good for negative self-speak, for changing your habits. We use it a lot in trying to lose weight, stopping smoking, those things where you're going, I need this. Hypnotherapy is going, really? Do you really? Is that the best thing for you? And we help to change your mind so that you can actually achieve some of your goals. I asked Steph, our hypnotherapist, for a very small list of what hypnotherapy does. And this is her small list. You want to see her full list. So she's a really neat person. Go and have a chat to her on the stand. But we see some really life-changing things with our homeopath and our hypnotherapist at My Remedy. Physical therapies are very important. It's so important to have hands-on health treatments. And so we've got massage. I'm not a massage therapist, but a natural medicine, massage and lymphatic drainage, osteopathy and chiropractic for those big structural changes and changes in form and function that we may need. Because if you are having constant symptoms and you've got a part of your body that's not responding properly, again, no amount of vitamin C is going to fix that. We need your body in the correct state so that you can function optimally. I'm a big fan of chiropractic care, and everyone's got their favourite treatment, but I just find having a physical therapy and a naturopathic therapy and someone to look after my mind when I need it, everything's taken care of. So natural medicine, whatever form you're using, it is about better sleep, good digestion, good energy, healthy immunity, and support for those acute and chronic conditions. It's really there to get you well. So thank you for listening to me. I'm hoping there'll be a few questions. We really need to take care of our body. It's the only one we've got, and it's for a limited time. So I think the more we can do to get it functioning well, the better. So thank you. Any questions? Yes.
How important is like with blood type eating and stuff like that? Does that work, and how important is that? And is that something you can strive?
Yeah. So the question is, how important is the blood type diet? Has anyone heard of that? Eating for your blood type? Yeah. I actually have used it in clinic for about 12 years. I think it's really important. I don't like diets as such, but I had to ask myself a question, and we're this one little human race, and we've got 4 blood types. And when there's a new fad out, so I'll be very careful. A new diet out. So we've had paleo, we've had the liver cleanse, we've had this one, we've had that one, and you'll always get a section of the community that goes, "Oh man, that's the best thing ever," and everyone has to do this because it works. And then you get the person next to you go, "I have never been so bunged up since I did that diet ever." So we are individuals. And it's based in the O blood type is basically the first one that they are aware of. And you are talking about the caveman. So, he goes out and he catches his meat and he picks some berries and he's really strong and robust and he's great. And there was no wheat at that point, nor was there dairy. So he's not going to do so well on wheat and dairy. Whereas the B type, who was more in the Nordic areas, they started planting some grains, so they're better with some carbohydrates. And they also started milking and needing those really high-fat meals. So you'll often find the B-type has either a very good or a relationship with dairy. And then there's the A-type, which is the most modern. We're looking at the Asian. Do really, really well. I'm actually an A-type. Not Asian, but I am an A-type. Do really well with loads and loads and loads of veggies and meat or no meat at all. And I know for myself, when I live my family's lifestyle, which is very blokey, I don't do so well, and when I take the time to eat from my blood type, I do really well. So that was a really long answer. I'll do some short answers if anyone's got short questions. No. Well, I do encourage you to go along to our stand and talk to our practitioners there, and I do encourage you to think about natural medicine as a first rather than an alternative choice in healthcare. Thank you.